My name is Joe Lamplot. I'm a sports medicine orthopedic surgeon here at the Campbell Clinic. I grew up in Chicago, in suburban Chicago, did all of my education in Illinois. Undergrad was the University of Illinois in Champaign. Medical school was the University of Chicago. I then did my residency in orthopedic surgery at Washington University in St. Louis. After that, I went to New York City and did my fellowship in sports medicine at the Hospital for Special Surgery. I did specialized training in shoulder, elbow, and knee surgery. I also had the opportunity to help take care of the New York Giants. Went to training camp and was with them throughout the entire season. And I also worked with the New York Red Bulls. And having those experiences taking care of those pro teams then helped when I started my career in Atlanta, where I assisted with the Atlanta Falcons for about 3 years. I've taken those experiences into practice here at the Campbell Clinic, and I really treat all of my patients the same way that I treat the professional athletes. I played sports all my life. So through high school, I was actually a 4-sport athlete, and I had just about every injury you can imagine. Having those interactions with my primary care doctor, orthopedic surgeons, and going through the rehabilitation process along the way made me kind of love the field. And when it got time to pick a field to go into in college, I knew I wanted to do sports medicine. When the opportunity arose to come to the Campbell Clinic, I hopped on it. It has a world-class orthopedic program, and within sports medicine also, it's a global leader. So from a clinical care standpoint, it's really the dominant practice in the market. And beyond that, regionally and nationally, it has a great reputation. So taking advantage of clinical care, the research opportunities, and the education opportunities, it just made complete sense for me to pursue this opportunity. So I would say my niches are anything within the knee, so knee ligaments, meniscus, cartilage repair and restoration, and then anything having to do with throwing athletes. So any athlete that baseball players, softball players, volleyball players, swimmers, any throwing related injuries to the shoulder or elbow is my wheelhouse. The patient volume here and the diversity of cases that we tackle is what I'm most looking forward to. I know, speaking of my colleagues that have been here for a long time, they're caring for athletes of all levels, professional, collegiate, high school, and weekend warriors. And I think caring for all conditions and all levels is what I'm really looking forward to. So I would say while we do take care of professional athletes, the bread and butter of our practices, 99% of our day-to-day is taking care of, weekend warriors, high school athletes, grade school athletes, right? In terms of my approach to professional level athletes and non-professionals, really it's quite similar. I think some of the counseling, some of the return to sport expectations, some of those discussions may be a little bit different because the stakes are quite high with professional athletes. But in terms of the techniques that we use surgically and with respect to rehabilitation, they're very similar. So I would say I treat all of my athletes very similarly with respect to techniques, rehab, etc.